Hello, welcome to Examhood. Today I want to look at another critical topic as far as health is concerned. I want to look at on our health tip today. I want to consider something very important, something very significant as far as our health is concerned. This is what people sometimes undermine, they underlook, but then it's becoming life-threatening. It's becoming a life-threatening challenge. And what is that? It's diabetes. Diabetes is one leading cause of disease that we have today. And so we have to be very careful. We have to try to prevent this life-threatening disease. What is actually diabetes? Diabetes is a presence of sugar in the body. When this sugar is in excess, it becomes a problem. So what is actually the cause of diabetes? You know, when you eat carbohydrates, when you eat food that contains carbohydrates, the end product of this food is glucose. So the body absorbs this food in the form of glucose. The remaining one is converted to another form and stored in the body, so that when the body needs it, it's reconverted back to glucose. But when a situation whereby there is no mechanism of converting this glucose to the form in which it will be used by the body, it becomes excess in the body, and it is said to be, that person is said to be diabetic. So the problem we have with diabetic patients is that they have problem with their insulin, that substance that converts excess sugar to the form that the body will use. When that substance or that thing is deficient, is having problem, there's excess sugar in the body. So diabetic patients have defective insulin. They have defective insulin. So if you want to categorize the cause of diabetes, there are two types of diabetes. Type 1 diabetes and type 2 diabetes. Type 1 diabetes is the one that is caused as a result of what we call autoimmune disorder. Autoimmune disorder is when the white blood cell begin to attack the insulin-producing pancreas in the body. Pancreas is a part of the body that produces insulin that should convert this excess sugar to the form that the body will use. But when there is the problem, when the pancreas has problem, it becomes a problem. So type 1 diabetes is when the cell of the body, the white blood cell, begin to attack it becomes a problem. So the insulin can no longer, the pancreas can no longer produce insulin that should convert this glucose to glycogen. So the glucose is left in abundance in the body. Then type 2 diabetes is when this one occurs as a result of our lifestyles, the way we live our life, the kind of food we eat. So that's one of the causes of type 2 diabetes. Most of us eat junky foods. We depend so much on fat, on processed foods, and all of that. All of this food constitutes sugar or glucose to accumulate in our body. And so another cause of type 2 diabetes is when the insulin that is produced is not enough to meet, to carry out its function. It's another cause of type 2 diabetes. The another cause is that it can be traced to what we call family history. Family history can also cause type 2 diabetes. If your family, you have a diabetes in your history, the family, there's that likelihood that you might also have it. Then the last cause of diabetes can be as a result of certain disease we call pancreatitis or cystic fibrosis. These are disease of the pancreas, the organ of the body that is responsible for the production of insulin. I told you that insulin is a key factor, is a key thing that converts glucose to glycogen. If there's no insulin in the body, or if the insulin is bad, that means that there will be excess glucose or sugar left in the blood or in the body. So these are the causes of diabetes, and it might interest you to know that type 2 diabetes is more common than type 1 diabetes. So what we have nowadays is mostly type 2 diabetes. Type 1 is not as common as type 2 diabetes. So let's briefly look at the symptoms you need to watch out when you have diabetes. What are the symptoms? Number one, someone who is diabetic is always urinating. There's frequent urination. Another symptom is that you are always drinking water, excessive water intake. Why are you always drinking water? Because the kidney that remove this sugar is being overloaded. There's excess blood and sugar in the body of diabetic patients. So this sugar is being removed alongside with urine out of the body. And so as this sugar is being removed alongside with urine, this sugar is gathering enough or is collecting enough water around the body and removing this water out of the body through urine. So when you have excess sugar in the body or in the blood, there's excess urination because there is enough sugar. And for your body to balance up the water you are losing through urination, you have to drink enough water to balance it up. And diabetic patient, when you urinate, if you check around your urine, you discover that ants will gather around your urine. The reason is that those ants, they gather around to feed from the sugar or from the sugary substance that you just excreted out of the body. So these are some of the symptoms. Another symptom of diabetes is what we call unexplained weight loss. There's unexplained weight loss, unusual weight loss. You begin to lose weight and you cannot even explain. The reason is that since the glucose or the sugar in your body or your blood cannot be utilized, the body turns to other form of other way to get this sugar or get energy, and the body will turn to degrading or metabolizing muscle or even fat that is supposed to add to the weight of the body. The body will begin to metabolize them in order to use energy, because the glucose in your body that's supposed to produce energy is not being useful. So that's another symptom, unexplained weight loss. Another one is slow sore healing. If you sustain any injury around your body, you discover that it will heal slowly. Yes, if you are diabetic, when you have injury, it will not heal fast. It's a serious problem. The reason is that there is a disruption in the blood vessels, preventing nutrient from reaching the site of the wound that will bring about healing. Another mechanism between this slow healing of wounds in diabetic patients is that sometimes these diabetic patients don't even know that they have wound on a particular part of their body because there's loss in sensitivity or loss in communication between that part of the body and the brain. So it's as serious as that. Another mechanism is that when you are diabetic, your immune system will be compromised, such that the immune system that is supposed to fight the wound and bring about healing is not there. So your wound, your body, that wound is left vulnerable. It can be further infected with more pathogens, which will cause further deterioration. So these are some of the symptoms of diabetic patient. Another one is that there's what we call vaginal yeast infection. It is when, as you're urinating, your urine contains sugar, and so some of the sugar will be accumulated within the vaginal area. And there are these microorganisms that are found, the yeast found at the vagina, that is supposed to naturally protect that region. So the microorganism will begin to feed on that sugar that is being left around that area. And these microorganisms that are supposed to protect you, they become pathogen, they become your enemy because your immune system is compromised. So they begin to feed on those sugar that is left in your vaginal area, and it will cause what we call vaginal yeast infection. So these are the symptoms of diabetes. Then let's look at the way, how do we diagnose diabetes? Early diagnosis of diabetes is very important. So it's very good that you go for checkup. We go for regular checkup to know if you are diabetic or not. When you go to the hospital or to the lab, they will use an instrument called glucometer. This glucometer, there's two types of diagnosis of diabetes. What we call the fasting blood sugar test, which is a test that is taken early in the morning. You don't eat before you take that test. So when you go, they'll collect your blood and put it on that instrument, that equipment. If that equipment reads 126 milligram per dl and above, it means that you are diabetic. Yes, it means that you are diabetic. Then the second test is the random blood sugar test. That test, you can take it at any time of the day, irrespective of whether you have eaten or not. So when you take that test and the reading is about 200 milligram per dl and above, it means you are diabetic. So it's good for us to go for regular checkup to know our sugar level. Then let's look at the way we can actually prevent this disease. It's a life-threatening disease, and it's good to, they say prevention is better than cure. The first way we can prevent this diabetes is by regular exercise. We need to do regular exercise. So exercise is not meant for athletes alone. Exercise should be normal for everybody. So as you're doing this regular exercise, if there are excessive fat in the body, this exercise, it will begin to metabolize and you'll be free. Another way to prevent this disease is that we should eat healthy. Don't just eat anything that come your way. Some people, anything that they see, they'll eat. Junky food, starch, fatty food, and all of that, processed food. So if you eat anything, it will constitute to sugar in your body and it becomes a life-threatening, it puts you at the risk of having a diabetes. So we should learn to eat healthy, patronize fruits and vegetables and the like, natural products. It will go a long way to help you stay free from this disease. Another way to prevent diabetes is to reduce or limit alcohol intake. By the time you take excessive alcohol, it will cause your body to accumulate fat or carbohydrate within your body. So we need to reduce alcohol intake. Another one is to quit smoking. If you are the type that is smoking, it's better you quit it, because when you are smoking, so many things will happen to you. Your body will become predisposed. It puts you at a risk of getting so many diseases. And the last way of preventing this disease is medication. So when you discover that you are down with this disease and there are no way out, or your case is becoming deteriorating, you need to take medication. There are insulin that have been processed into capsule and tablet. You should take them, and it will go a long way to help. So diabetes is a life-threatening issue. We need to prevent it, and it's not just meant for the age, for the adult, because it's more common, prevalent in the adult than the youth. But the youth can live a lifestyle that will prevent them from having it when they get to the old age. So I continue to enjoy us to eat healthy and take other precautionary measures so that we can stay free from this life-threatening disease. Thank you so much. See you in our next video. Bye-bye.